main symptoms that patients will complain of when they suffer from thyroid eye disease includes achy eyes, dry, gritty eyes. They also complain of light sensitivity, what we call photophobia, and some patients can also suffer from dry eyes and double vision. When it's quite severe, patients also complain of blurred vision and that their color vision is also affected in that red colors can become more faded. In the main, the patients who get referred do have a history of an overactive or an underactive thyroid, but it is not uncommon for opticians to refer patients with just the eye signs of thyroid eye disease into the casualty department here, or indeed to the oculoplastics department. If you have eye problems, there are specific treatment for the eyes. But in general, if you know that you have an overactive or an underactive thyroid, if you get that managed well and keep your thyroid hormone levels within normal, that will be better for your eye condition as well. We know that smoking is very bad for the eyes in patients with thyroid eye disease, so if you can stop smoking, that's probably a really good thing that you can do to protect your eyes. So the evidence of vaping is still out there, but we're certain that even vaping is no good for your eyes. So again, we would advise patients not to vape. We know from lots of studies that thyroid eye disease follows a curve. So it always tends to get worse before it stabilizes, and then it burns itself out, and during that period your eyes can get better. When you have inflammation, which is in the main what causes the problems in thyroid eye disease, the main forms of treatment are to ensure that the inflammation is dampened down and under control. If your disease is mild, then actually you probably just need lubricants for your eyes to make the eyes feel comfortable. But if you have got more moderate disease, you can have non-steroidal anti-inflammatories. But when your disease is quite active, we tend to give something to suppress your immune system. And this is usually in the form of steroid treatment, whether that be intravenously or with tablets. If you are getting a lot of side effects from steroids, there are steroid-sparing agents like called mycophenolate, cyclosporin, or methotrexate. We also use orbital radiotherapy, and in some cases you might even need surgery for your eyes in thyroid eye disease. There are two main time periods, if you will, where we offer patients surgery. The first is if your disease is so active that we are unable to control it with steroids, for example, and you're losing vision, then we would offer orbital decompression. So that is to create space around your eyes, particularly around the optic nerve, to protect vision. So the other period is when the disease has burnt out. Patients do suffer consequences of the disease. They have very bulgy eyes, they have exposure problems with their eyes, and they can also have double vision because of squint. So during those periods, we would offer surgery to set the eyeballs back, which is the same as the decompression surgery I mentioned earlier, or you can have eyelid surgery in order to lower the eyelids or to raise the bottom lids so that the eyes don't look so exposed. Essentially, if your disease is mild, then you don't need any specific medical or surgical treatment. So conservative methods like lid hygiene, using artificial teardrops, will help your eyes feel more comfortable. Now, in terms of surgery, we tend to offer surgery once we know your condition is stable. So for example, if your eyes are still getting more and more bulgy and your vision is stable, we tend to wait until the condition has stabilized, because otherwise we would be trying to fix a problem that was still either going to get worse or get better on its own. So then the surgery that we offer you isn't going to be as effective during those periods of instability. We always offer surgery where it's indicated. In terms of lower lid surgery, if you have a functional problem from your thyroid eye disease, for example, your lower lids are retracted, i.e. pulled down, and there's exposure and dryness, we would also always offer surgery to try to improve that. So lower lid retraction surgery is usually routinely offered. If we're talking about eye bags or the fattiness around the eyes that can happen with thyroid eye disease, then if it's purely a cosmetic problem, it is unlikely that we will offer you surgery routinely. However, we do accept that this can affect patients psychologically, so we can put in individual funding requests to ask the NHS to fund eye bag surgery, i.e. lower lid blepharoplasty as well. If you have mild thyroid eye disease, then there's a good chance that once you're in that inactive stage, your eyes can come back to normal. But if you've suffered significant inflammation around the eyes, even with treatment and with time, it's unlikely that your eyes will ever go back to exactly the way they were before. And this is why sometimes we offer surgery in order to try to restore normality for the patient. If your thyroid hormone levels are not kept within a normal level, or if you smoke or vape, then you are increasing your chances of the disease flaring back up again. But if you do all the right things, then once it's burnt out, it is much less likely that it will flare up again. If your Graves' disease is under good control, you can still get thyroid eye disease. So we find that even patients with normal thyroid function can present with quite severe thyroid eye disease. So the two are not always directly related. However, if you do have Graves and that is kept under good control and you respond well to the treatment we give for your eyes, then the prognosis is much better. So I think if you keep your thyroxine levels, your thyroid hormone levels under good control, and you don't have bad habits like smoking or vaping, then it is less likely that you're going to get the eye issues. Clinical activity score that we use is quite a useful tool to tell us how active the patient's eyes are. In essence, it measures the level of inflammation in the eyes at any one period of time. And we use that clinical activity score to monitor progression or improvement in the disease, especially when we give patients the treatment. So it's quite useful to tell us whether you're responding or not to the treatment that we're giving you. In the Joint Thyroid Eye Clinic, you do have experts like myself who will be able to give you as much information about your eye condition as possible, but a lot of patients find it very useful to be able to speak to other patients who've gone through the same problem. And this is where organizations like the British Thyroid Foundation are very helpful. Smoking is bad for your eyes, especially if you've got thyroid eye disease, and most GP practices offer help to stop smoking. There's been quite a lot of new research into thyroid eye disease, and the results have been quite good, not only in controlling the inflammation, but actually improving on the bulginess or the proptosis that patients suffer from. In the UK, these drugs are only available as trials, and indeed there are new biological agents being trialed in the UK at present. In Leeds, for example, we are one centre for such a trial, and again, the results, although they're very early on, are quite promising in terms of improving the prognosis for patients with thyroid eye disease. We know that patients with thyroid eye disease suffer greatly, not just because of the inflammation in the eyes, but the impact on their appearance, and the psychological impact can be very severe. And we're always keen to get patients into our clinics as quickly as possible, because the quicker we catch you on the inflammatory curve, the more likely it is that we're able to control your problem and to improve the outcome that you're going to get. So I would say, if you're worried about your eyes, your first port of call is usually your community optometrist. Let them check out your eyes, and if they find any issues, you will get a referral and we will be able to treat you much sooner.